So I think it's pretty simple. It doesn't take a lot of thought. You can just sign up for Twitter, get on a blog, or even start your own. It's really up to the individual person how much they want to participate or not. You can be entirely passive to following certain physicians or even journals on Twitter and just getting updates of new publications that come out. And you can go all the way up to creating your own podcast if you have something interesting to say, to try to interview other colleagues or get other people all talking about evidence-based medicine, whatever you want. It's really open, and that's part of the best thing to do with social media. One of the reasons why I started the blog that I run, which is the Emergency Medicine PharmD blog, is when I left residency, I kind of was in an environment that was foreign, so there really wasn't a syllabus to follow. I didn't have anybody looking over my shoulder, making sure I was, keeping up on reading. So there's really a lack of structure. So getting into a little bit of the social media on the emergency medicine perspective, there's a lot of blogs and podcasts out there that were talking about certain evidence and different procedures that I wanted to keep up to date on, and it started to help weed through all the mounting articles that I had piled up on my desk in the to-read pile. So, going through that process, I started to realize obviously there's not a lot of pharmacy representation in these discussions, so I thought it'd be a great opportunity to really be the voice of the pharmacist in the emergency department, try to describe what an ED pharmacist is doing, and look at some of the evidence from our perspective as a pharmacist. So we've kind of grown the blog. I have a few of my residents that have come through the program participate in the blog as well, and we're starting to get more ED pharmacists across the country to participate in the blog and give their own perspectives, since again, it's social media, it's socially based, so we want to get as many perspectives as possible. With the podcast, it was just kind of an evolution from that, where the readership enjoyed a lot of the things we were talking about, and the podcast seemed to be a great avenue to discuss things that weren't easily describable in print. You just kind of had to describe them. So some of the new pipeline agents with the oral anticoagulant and the reversal agents, it was a great avenue to use on the podcast rather than through the blog.